Friends, have you got an injury in the knee? After the injury, you're not having confidence on the knee. Your knee feels like it's giving way. You're unable to run. You're unable to play. You're unable to jump. You're unable to climb stairs. If you have all these problems, then you must watch this video. This video is about ACL tear. My name is Karthik Selvaraj. I'm an orthopedic surgeon. I work at KS Ortho Care, Coimbatore. Okay, what is ACL? ACL is basically anterior cruciate ligament. This is a ligament which connects the thigh bone to the leg bone. Now, what is the function of ACL? The ACL basically is not needed when you walk in a straight line. But when you pivot, what is pivoting? Pivoting is basically you put your foot down firmly on the ground and you twist. So when you stand and twist your body, the ligament, the ACL, that is the one which is holding your thigh bone to the leg bone. So that is the one which gives stability to the knee. So for movements like jumping and landing, jump landing, fast walking, running, climbing up the stairs and down the stairs, if you don't have ACL, if you don't have the ACL ligament, you don't have the anterior cruciate ligament, if you are torn the anterior cruciate ligament, your knee will feel unstable. It will feel like it will give. Now what happens when the knee gives way? Basically, the thigh bone twists on the leg bone. So when the thigh bone twists on the leg bone, there are shock absorbers between the two bones which prevent the bones from rubbing. They are called the menisci. So there are two menisci, one on the inside which is called the medial meniscus, one on the outside is called the lateral meniscus. Now the inside meniscus and the outside meniscus, they prevent the bones from rubbing, thereby preventing what we call as osteoarthritis or wear and tear in the knee. Now when the knee slips or when the knee twists and the knee gives way, what happens is the meniscus gets torn. When the meniscus gets torn, then there is a very high chance that your knee can get locked. It can get locked in a position that you are unable to bend it or extend it. And in the long run, when the meniscus is not there, your knee is at a high risk of developing osteoarthritis or wear and tear. So these are things which you have to keep in mind when you develop an ACL injury. Now what happens usually? How does this ACL gets injured? It's a sports injury basically. Mostly people playing sports like football, basketball, volleyball, whichever involves pivoting, jump landing, running, these sort of sports persons, they develop this injury. So both contact athletes and non-contact athletes can develop this injury. So when this happens, usually your knee suddenly gets swollen, you're unable to walk and your knee starts giving way. Now you immediately consult a doctor or a physiotherapist. They do the first aid sort of treatment, compression, ice, elevation and all that. But after a while, it seems to get better. But on an occasion, on a very important moment, it can slip and give way. Now when that happens, usually the doctor comes and examines you. When the doctor examines, with his hands, he can find out that there is some laxity in your knee. We have specific tests to find that out. Once we find that out, then what we do basically is send you for x-rays. We look at if there is any bony injury, and once the bony injury is ruled out, then we get an MRI scan. Now the MRI scan actually confirms the diagnosis of an ACL. Now, how can you manage an ACL tear? Suppose you got an ACL tear. So how do you manage it? Do you always need surgery? This is a big question among youngsters. It's a very common injury among youngsters. So ACL does not need surgery all the time. So most of the time, when the knee feels reasonably stable, the patient, we have specific tests to test the stability of the knee. The knee feels reasonably stable. We usually prescribe exercises in a standard fashion, and then we reassess you, and in every interval of 2 to 3 weeks we change the exercises, and within a period of 2 to 3 months we can make your knee perfectly stable without a surgery. Now can everyone just undergo physiotherapy and become stable? That's not possible. About 50% of patients who have ACL injury, athletes who have ACL injury, can be managed non-operatively, meaning only with physiotherapy. About 50% of these patients and athletes who develop ACL injury, they cannot cope with physiotherapy. They don't get better with physiotherapy, which means the other muscles and ligaments, they don't take over the function of ACL in those patients. In those patients, they require surgery. But the great thing or the good thing about this ACL injury is the surgery is very simple and straightforward. It does not involve open surgery. It involves what we call as an arthroscopy. It is a keyhole surgery. So arthroscopy is basically making two small holes, introducing camera inside the knee joint and then performing the entire surgery through keyholes. Now, the ACL cannot be repaired. It's not a structure which can heal. So what we normally do is we reconstruct the ACL. So what we mean by reconstruction is basically we make a new ACL for you. Now, where do we get the tissue for the new ACL? You have beautiful tissues which are actually extra lying very close to the knee joint. We call them as hamstring tendons. Sometimes we use the patellar tendon. Very rarely we use the peroneus tendon. So these are the common extra tendons which are available, which we can take from your own body and make a new ligament for you. The surgery involves 1 day in the hospital. Usually you walk the next day, and you might need a pair of crutches for maybe a couple of weeks. After that, you shed away your crutches and you just walk normally. Running and jogging usually takes about 4 months. Return to play is usually 6 to 9 months depending on other injuries you have. Now, whenever an ACL gets injured, there is always a possibility that there are other structures around the knee can also get injured. Now, there are other ligaments in the knee, the PCL, the MCL, the LCL. So, the MCL and the LCL are the side ligaments which basically give stability on the inside and outside of the knee. And there is a PCL which gives the stability on the back side of the knee. And the ACL is the front. And then you got the menisci. Injury to other structures, like if there is a meniscal tear, if there is a PCL injury, if there is an LCL or an MCL injury, depending on that, the treatment will vary. With modern advances, most of the time we can operate you and rehabilitate you quicker so that you recover very quickly and go back to normalcy. You go back to your work, you go back to playing very quickly. That's the aim of today's medical management and surgical management. So you don't need to panic and worry that there is a injury to my knee. What will happen in the future? This is not of concern to you. There are very simple, easy, scientific methods to treat your knee injury. So consult your doctor. If you have any queries or comments, please post us and we'll be happy to answer you. Thanks and best wishes for early recovery.